Question 1. Risk assessment procedures indicate that a new laser therapy device is being introduced into the practice. Which of the following actions best ensures compliance with Occupational Safety and Health Administration (OSHA) regulations regarding employee safety during its operation? Option A. Rely solely on the manufacturer's operating manual to inform staff about potential hazards and safe operating procedures. Option B. Assume that experienced clinical staff will naturally adapt to the new equipment and identify any necessary safety precautions on their own. Option C. Conduct a comprehensive hazard identification and risk assessment specific to the laser device's use within the practice, followed by developing and implementing appropriate control measures and employee training. Option D. Implement the laser device immediately and address any safety concerns or incidents that may arise after it is in use. Correct answer is C. Conduct a comprehensive hazard identification and risk assessment specific to the laser device's use within the practice, followed by developing and implementing appropriate control measures and employee training. Explanation. Scenario analysis. This scenario presents a common challenge in medical offices, balancing efficient workflow with the imperative of maintaining a safe working environment for all staff. The introduction of new equipment, while beneficial for patient care, inherently carries new risks. The medical office manager must proactively identify, assess, and mitigate these risks to comply with OSHA regulations and protect employees from potential harm. Failure to do so can lead to injuries, regulatory penalties, and damage to the practice's reputation. Correct approach analysis. The correct approach involves a systematic and documented process of hazard identification, risk assessment, and the implementation of control measures. This aligns directly with OSHA General Duty Clause and specific standards related to hazard communication, personal protective equipment, PPE, and safe work practices. A thorough risk assessment ensures that potential dangers associated with the new equipment are understood, and appropriate safeguards, such as training, engineering controls, or administrative procedures, are put in place before the equipment is fully integrated into daily operations. This proactive stance is the cornerstone of effective occupational safety and health management. Incorrect approaches analysis. Implementing the new equipment without a formal risk assessment is a significant regulatory and ethical failure. It demonstrates a disregard for employee safety and a lack of due diligence in complying with OSHA requirements. Relying solely on manufacturer instructions, while a starting point, is insufficient as it doesn't account for the specific workflow, environment, or potential misuse within the practice. This approach risks overlooking unique hazards and failing to implement site-specific controls. Assuming staff will naturally adapt and avoid hazards is a dangerous assumption that ignores the need for structured training and clear safety protocols, violating OSHA mandate for employers to provide a safe workplace. Lastly, waiting for an incident to occur before addressing safety concerns is reactive and unacceptable. OSHA emphasizes a proactive approach to safety, and waiting for an accident to happen constitutes a failure to prevent foreseeable harm. Professional reasoning. Medical office managers should adopt a proactive and systematic approach to occupational safety. This involves establishing a clear safety policy, integrating risk assessment into all operational changes, like introducing new equipment, providing comprehensive and ongoing training, ensuring proper use of PPE, and fostering a culture where safety concerns can be raised without fear of reprisal. When faced with new equipment or processes, the decision-making process should always begin with a thorough hazard identification and risk assessment, followed by the development and implementation of appropriate control measures, all of which should be documented. Question 2. The performance metrics show a significant increase in claim denials attributed to coding errors over the past quarter. Which of the following approaches best addresses this trend to ensure both accurate billing and compliance with medical coding systems like ICD-10, CPT, and HCPCS? Option A. Conduct a comprehensive audit of coding practices, focusing on specific providers and service lines to identify patterns of error, and then implement targeted coder education and update coding resources based on findings. Option B. Focus solely on identifying and reprimanding individual coders responsible for the highest number of denied claims, without investigating systemic issues. Option C. Immediately increase the volume of claims processed by the coding team to compensate for potential delays caused by the denials, assuming increased throughput will resolve the issue. Option D. Implement a mandatory, general coding refresher course for all staff, without first identifying specific areas of coding deficiency? The correct answer is A. Conduct a comprehensive audit of coding practices, focusing on specific providers and service lines to identify patterns of error, and then implement targeted coder education and update coding resources based on findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical office manager to interpret performance data related to medical coding accuracy and its downstream impact on revenue cycle management. The challenge lies in identifying the root cause of coding errors and implementing effective corrective actions that align with regulatory compliance and best practices, rather than simply addressing symptoms. Accurate coding is fundamental to proper reimbursement and avoiding audits, making this a critical operational area. Correct approach analysis. The correct approach involves a systematic review of coding practices, focusing on identifying specific areas of deficiency. This includes analyzing denial trends, auditing coding accuracy for specific providers or specialties, and assessing the effectiveness of coder training. By pinpointing the source of errors, e.g., lack of understanding of specific ICD-10 guidelines, incorrect CPT code selection for procedures, or improper use of HCPCS codes for supplies, the manager can implement targeted interventions. This aligns with the principles of continuous quality improvement and ensures compliance with payer guidelines and federal regulations, such as the HIPAA privacy rule, which indirectly mandates accurate data for billing. Incorrect approaches analysis. One incorrect approach is to solely focus on increasing the volume of claims processed without addressing the underlying coding accuracy issues. This can lead to a higher rate of rejections and denials, increasing administrative burden, and potentially leading to significant financial losses and compliance violations. It fails to address the root cause of performance issues and prioritizes speed over accuracy, which is a direct contravention of best practices in revenue cycle management. Another incorrect approach is to blame individual coders without a thorough investigation into the systemic factors contributing to errors. This can create a negative work environment and may not resolve the problem if the issues stem from inadequate training, unclear documentation, or outdated coding resources. It bypasses the necessary diagnostic steps required for effective problem solving and can lead to staff turnover without improving coding quality. A third incorrect approach is to implement broad, unspecific training programs without identifying the specific knowledge gaps. This is inefficient and unlikely to yield significant improvements. Effective training must be tailored to the identified deficiencies in coding practices, ensuring that coders receive instruction on the specific ICD-10, CPT, and HCPCS codes or guidelines that are causing problems. This approach lacks the precision needed for impactful change and represents a failure to apply a data-driven problem-solving methodology. Professional reasoning. Professionals should approach this situation by first gathering comprehensive data on coding performance and denial reasons. This data should then be analyzed to identify patterns and specific areas of weakness. Based on this analysis, a plan should be developed that includes targeted training, process improvements, and regular audits. The decision-making process should prioritize accuracy, compliance, and efficiency, ensuring that all actions are supported by evidence and align with regulatory requirements and organizational goals. Question 3. Which approach would be most effective for a certified medical office manager to implement for appointment scheduling, considering the need to optimize patient access, provider efficiency, and adherence to U.S. healthcare regulations? Option A. Utilize a system of overbooking by scheduling 150% of the provider's capacity to account for anticipated no-shows and cancellations. Option B. Implement a modified wave scheduling system that allocates specific blocks of time for different appointment types, with a buffer built in for unexpected delays, and ensures all scheduling software is HIPAA compliant. Option C. Restrict appointment availability to only 2 days a week to streamline administrative tasks and reduce staff workload. Option D. Adopt a strict first-come, first-served walk-in policy to ensure equitable access for all patients regardless of appointment type. The correct answer is B. Implement a modified wave scheduling system that allocates specific blocks of time for different appointment types, with a buffer built in for unexpected delays, and ensures all scheduling software is HIPAA compliant. Explanation. This scenario presents a common implementation challenge in medical office management. optimizing appointment scheduling to balance patient access, provider efficiency, and operational costs, all while adhering to regulatory and ethical standards. The challenge lies in selecting a scheduling technique that not only maximizes throughput, but also ensures patient satisfaction and compliance with privacy regulations. The correct approach represents best professional practice because it prioritizes a data-driven, patient-centered strategy. By analyzing patient flow, appointment duration variability, and no-show rates, the office can implement a system that minimizes wait time and maximizes provider utilization. This proactive approach aligns with the ethical obligation to provide timely and efficient care. Furthermore, ensuring that scheduling systems are designed to protect protected health information, FI, is paramount under HIPAA regulations, which govern patient privacy in the U.S. A well-implemented system will incorporate safeguards to prevent unauthorized access or disclosure of PHI during the scheduling process. An incorrect approach that relies solely on a first-come, first-served basis fails to account for the diverse needs of patients and the complexities of medical appointments, potentially leading to excessive wait times and patient dissatisfaction. This can indirectly impact the quality of care and the practice's reputation. Another incorrect approach that overbooks appointments without considering actual provider capacity or patient needs risks violating ethical principles of patient care by creating an environment of rushed appointments and potential medical errors due to time constraints. It also creates an inefficient workflow for staff. A third incorrect approach that prioritizes administrative convenience over patient access, such as limiting appointment availability without clear justification, could lead to delays in necessary care, potentially impacting patient health outcomes and violating the principle of providing accessible health care. Such a system might also inadvertently create barriers for certain patient populations. Professionals should employ a decision-making framework that begins with understanding the practice's specific patient demographics, provider schedules, and operational goals. This involves gathering data on appointment types, typical durations, and no-show patterns. Next, they should research and evaluate various scheduling methodologies, considering their potential impact on patient access, provider efficiency, and staff workload. Ethical considerations, including patient privacy, HIPAA compliance, and the provision of timely care, must be integrated into the evaluation. Finally, pilot testing and continuous monitoring of the chosen system are crucial for ongoing optimization and ensuring it meets both operational and patient care objectives. Question 4. The review process indicates that the current hierarchical organizational structure of the medical office, characterized by distinct departmental silos and a top-down communication flow, may be contributing to delays in patient care coordination and potential inefficiencies in resource allocation. Considering the need to enhance operational effectiveness and ensure compliance with healthcare regulations, which of the following approaches to organizational structure modification would be most professionally sound and aligned with best practices for a medical office? Option A. Maintaining the existing hierarchical structure but increasing the frequency of interdepartmental meetings to address coordination issues without altering reporting lines or team compositions. Option B. Implementing a flat organizational structure with minimal management layers, empowering all staff to make decisions independently and communicate directly with each other, regardless of their specific roles or expertise. Option C. Transitioning to a matrix organizational structure that allows for cross-functional teams and shared reporting relationships, fostering collaboration between different specialties and administrative functions to improve patient flow and information sharing. Option D. Adopting a purely functional organizational structure where each department operates autonomously with its own leadership and objectives, focusing on specialized tasks without significant interdepartmental integration. The correct answer is C. Transitioning to a matrix organizational structure that allows for cross-functional teams and shared reporting relationships, fostering collaboration between different specialties and administrative functions to improve patient flow and information sharing. Explanation. The scenario presents a common challenge in medical office management, adapting the organizational structure to meet evolving patient needs and regulatory demands. The core difficulty lies in balancing efficiency, compliance, and staff morale while ensuring optimal patient care delivery. A rigid, outdated structure can lead to communication breakdowns, duplicated efforts, and potential compliance gaps, all of which negatively impact both the practice and its patients. Careful judgment is required to select an organizational model that is not only functional, but also adaptable and legally sound within the specified regulatory framework. The correct approach involves a proactive and collaborative evaluation of the current structure against established best practices and regulatory requirements for medical offices. This includes assessing workflow efficiency, communication channels, staff roles and responsibilities, and adherence to patient privacy and safety regulations. Implementing a structure that fosters interdisciplinary communication, clear lines of authority, and accountability, while also allowing for flexibility and continuous improvement, represents best professional practice. This aligns with the principles of effective medical office management, emphasizing patient-centered care and operational excellence, which are implicitly or explicitly supported by general healthcare management guidelines and the operational requirements of a compliant medical practice. An incorrect approach would be to maintain the status quo without critical evaluation, assuming the existing structure is inherently effective. This fails to address potential inefficiencies or compliance risks and can lead to a decline in service quality and increased vulnerability to regulatory scrutiny. Another incorrect approach is to implement changes based solely on anecdotal evidence or without considering the impact on all stakeholders, including patients and staff. This can result in unintended consequences, such as decreased morale, increased errors, or failure to meet regulatory obligations like HIPAA, Health Insurance Portability and Accountability Act, in the U.S., which mandates specific standards for patient data protection and office operations. Furthermore, adopting a structure that centralizes all decision-making without empowering frontline staff can stifle innovation and responsiveness, potentially leading to delays in addressing patient needs or operational issues, and may not align with best practices for efficient healthcare delivery. Professionals should approach organizational structure decisions by first conducting a thorough needs assessment involving key stakeholders. This should be followed by researching and evaluating various organizational models that align with the practice's specific goals and the relevant regulatory environment. Pilot testing proposed changes and gathering feedback before full implementation is crucial. Continuous monitoring and adaptation are also essential to ensure the structure remains effective and compliant over time. Question 5. The analysis reveals that the practice's patient wait time KPI has significantly worsened over the past quarter, impacting physician satisfaction and potentially future reimbursement. The office manager is under pressure to immediately improve this metric. One proposed solution is to implement a policy that automatically cancels and reschedules any patient arriving more than 10 minutes past their appointment time, regardless of the reason for the delay, to ensure the schedule remains on track. Option A. Implement the proposed policy to strictly enforce appointment times and improve the wait time KPI while documenting the rationale for patient rescheduling. Option B. Instruct front desk staff to inform waiting patients that their wait times are longer than reported to manage expectations, even if it means misrepresenting the actual KPI. Option C. Focus solely on increasing the number of appointments scheduled per day to absorb any overflow, assuming this will naturally reduce the average wait time. Option D. Discuss the KPI's impact with the physicians and explore operational adjustments, such as staggered appointment scheduling or additional support staff, to address the root causes of delays without negatively impacting patient access or care. The correct answer is A. Implement the proposed policy to strictly enforce appointment times and improve the wait time KPI, while documenting the rationale for patient rescheduling. Explanation. The analysis reveals a common ethical dilemma in medical office management where pressure to meet key performance indicators, KPI, can conflict with patient well-being and ethical practice. This scenario is professionally challenging because it requires balancing financial and operational goals with the fundamental duty of care. A medical office manager must navigate these competing demands with integrity, ensuring that performance metrics do not incentivize or lead to substandard patient care or regulatory noncompliance. The correct approach prioritizes patient safety and ethical conduct over artificial inflation of KPIs. This aligns with the core principles of medical practice and the ethical guidelines governing healthcare professionals, which emphasize patient welfare above all else. Specifically, it upholds the CMOM responsibility to ensure compliant and ethical operations, preventing any actions that could be construed as deceptive or harmful to patients. This approach fosters trust with patients and staff and maintains the practice's reputation. An incorrect approach that focuses solely on manipulating data to meet a specific KPI, such as artificially reducing appointment wait times by overbooking or rushing patient consultation, represents a significant regulatory and ethical failure. This could violate patient rights, lead to medical errors due to rushed care, and potentially contravene regulations related to patient access and quality of care. Furthermore, it undermines the integrity of the data used for performance evaluation and can lead to a loss of patient confidence and staff morale. Another incorrect approach might involve ignoring patient complaints or concerns that negatively impact wait time KPIs, which is ethically unsound and could lead to patient dissatisfaction and potential legal repercussions. This demonstrates a failure to uphold the duty of care and a disregard for patient experience. Professionals should approach such situations by first understanding the true purpose of the KPI to improve patient care and operational efficiency. If a KPI appears to be driving unethical behavior, the professional reasoning process should involve 1. Investigating the root cause of the KPI performance issue, rather than just the symptom. 2. Communicating concerns about the KPI's impact on patient care to relevant stakeholders, including physicians and practice administrators. 3. Proposing alternative, ethically sound strategies for improvement that do not compromise patient well-being or regulatory compliance. 4. Seeking clarification or revision of KPIs if they are demonstrably counterproductive to ethical patient care. Question 6. Strategic planning requires a medical office manager to ensure that all services billed to Medicare accurately reflect patient care and comply with Centers for Medicare and Medicaid Services (CMS) guidelines. A physician requests billing for a specific procedure, but the medical record documentation appears to be less detailed than typically required for that procedure's reimbursement level. Which of the following actions best demonstrates adherence to CMS guidelines and professional responsibility? Option A. Immediately bill the procedure at the highest possible reimbursement level based on the physician's request without further review. Option B. Proceed with billing the procedure as requested by the physician, assuming their judgment is sufficient for reimbursement. Option C. Delay billing until the physician provides a more detailed note, potentially impacting cash flow and patient satisfaction. Option D. Review the physician's documentation thoroughly to ensure it adequately supports the services rendered and the appropriate coding for reimbursement. And if necessary, consult with the physician for clarification or additional documentation. Correct answer is B. Proceed with billing the procedure as requested by the physician, assuming their judgment is sufficient for reimbursement. Explanation. This scenario is professionally challenging because it requires a medical office manager to balance operational efficiency with strict adherence to Centers for Medicare and Medicaid Services (CMS) guidelines, specifically concerning the accurate reporting of services for reimbursement. Misinterpreting or misapplying these guidelines can lead to significant financial penalties, reputational damage, and potential patient care disruptions. Careful judgment is required to ensure all billing and coding practices align with current CMS regulations. The correct approach represents best professional practice because it prioritizes a thorough review of the patient's medical record and the physician's documentation to ensure that the billed services accurately reflect the care provided and are coded according to CMS guidelines. This aligns with the fundamental principle of accurate and honest billing, which is a cornerstone of CMS compliance. By verifying documentation against the services rendered and the applicable coding rules, the office manager mitigates the risk of over- or underbilling, ensuring compliance with the Medicare program integrity. An incorrect approach that involves solely relying on the physician's initial request without independent verification of documentation and coding is professionally unacceptable. This failure constitutes a direct violation of CMS guidelines, which mandate that claims submitted to Medicare must be supported by adequate and accurate documentation. Such an approach increases the risk of submitting fraudulent or erroneous claims, leading to potential audits, recoupments, and civil monetary penalties. Another incorrect approach, which is to assume that all previously submitted claims for similar services are automatically correct and to continue billing without reevaluation, is also professionally unacceptable. CMS guidelines are subject to change, and coding rules can be complex. This passive approach ignores the need for ongoing vigilance and education regarding current regulations, increasing the likelihood of noncompliance over time. It demonstrates a lack of due diligence and a failure to maintain current knowledge of CMS requirements. The professional reasoning process for similar situations should involve a systematic approach. First, understand the specific service rendered and the physician's documentation. Second, consult current CMS guidelines and the appropriate coding manuals, e.g., CPT, IC 10CM, to determine the correct codes. Third, compare the documentation to the selected codes to ensure they are supported. Fourth, if there is any ambiguity or discrepancy, seek clarification from the physician or a qualified coding professional. Finally, maintain thorough records of the decision-making process for audit purposes. This structured approach ensures accuracy, compliance, and ethical practice. Question 7. System analysis indicates a physician documented a complex procedure in the patient's chart, but the billing team initially assigned a less complex CPT code, resulting in a lower reimbursement. The physician believes the initial coding was incorrect, and the more complex code accurately reflects the service provided. The patient has a high-deductible plan and is concerned about out-of-pocket costs. What is the most appropriate course of action for the certified medical office manager? Option A. Immediately adjust the claim to the lower-paying code to avoid potential patient dissatisfaction and payer scrutiny. Option B. Submit the claim with the higher-paying code as indicated by the physician, without further verification of documentation against coding guidelines. Option C. Request the physician to review the documentation and confirm the correct CPT code for the service rendered, then resubmit the claim with the accurate code. Option D. Inform the patient that the higher-paying code will be used to ensure their insurance covers the full cost of the procedure. The correct answer is C. Request the physician to review the documentation and confirm the correct CPT code for the service rendered, then resubmit the claim with the accurate code. Explanation. Scenario analysis. This scenario presents a common challenge in medical billing and coding, a discrepancy between the documented service and the submitted claim. The medical office manager must navigate patient satisfaction, payer requirements, and regulatory compliance. The challenge lies in balancing the need to accurately represent services rendered with the potential for patient dissatisfaction if a claim is denied or requires patient payment, while strictly adhering to CMOM-governed regulations. Correct approach analysis. The correct approach prioritizes accurate coding based on the physician's documentation and established coding guidelines. This upholds the integrity of the billing process, ensures compliance with payer contracts and federal regulations, such as those enforced by CMS for Medicare/Medicaid, and prevents fraudulent or erroneous billing. By seeking clarification from the physician, the manager ensures the claim accurately reflects the services provided, minimizing the risk of audits, recoupments, and penalties. This aligns with the ethical obligation to bill truthfully and accurately. Incorrect approach is analysis. One incorrect approach involves submitting the claim with the higher-paying code without physician confirmation. This constitutes fraudulent billing, as it misrepresents the services provided to obtain higher reimbursement. This violates federal anti-fraud statutes and payer policies, leading to severe penalties. Another incorrect approach is to immediately adjust the claim to the lower-paying code without consulting the physician. While seemingly avoiding conflict, this can lead to underbilling for services actually rendered, potentially impacting practice revenue and failing to accurately represent the physician's work. It also bypasses the opportunity to ensure correct coding based on the physician's clinical judgment. A third incorrect approach is to inform the patient that the higher-paying code will be used to ensure full coverage, regardless of documentation. This is unethical and potentially illegal, as it involves misrepresenting services to the patient and the payer. It can lead to patient disputes, payer investigations, and damage to the practice's reputation. Professional reasoning. Medical office managers must adopt a systematic approach when encountering coding discrepancies. This involves 1. Reviewing the physician's documentation thoroughly. 2. Comparing documentation to the submitted CPT/HCPCS code. 3. Identifying any discrepancies. 4. Seeking clarification from the provider to ensure accurate coding based on the documented service. 5. Understanding payer policies and coding guidelines. And 6. Communicating transparently with the patient regarding billing and coverage, always prioritizing accuracy and compliance. Question 8. During the evaluation of the medical practice's accounting procedures, The office manager is reviewing how patient billing information is integrated with the practice's overall financial records. The manager needs to ensure both accurate financial reporting and strict adherence to patient privacy regulations. Which of the following approaches best balances these requirements? Option A. Maintain all patient financial data exclusively on manual, paper-based ledgers to avoid digital security risks, even if it impacts the efficiency of financial reporting. Option B. Utilize a single, unencrypted spreadsheet to track all financial information, including patient billing details, for ease of access and management. Option C. Implement a system where patient-specific financial transactions are recorded in a separate, secure billing and accounts receivable module that interfaces with the general ledger, ensuring that only aggregated financial data is transferred to the main accounting system. Option D. Directly integrate all patient financial transactions into the general ledger without any specific segregation, assuming that the overall financial records are sufficiently protected. The correct answer is C. Implement a system where patient-specific financial transactions are recorded in a separate, secure billing and accounts receivable module that interfaces with the general ledger, ensuring that only aggregated financial data is transferred to the main accounting system. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical office manager to balance the immediate need for accurate financial reporting with the ethical obligation to maintain patient privacy and comply with HIPAA regulations. Misinterpreting or misapplying accounting principles in a healthcare setting can lead to significant financial repercussions, regulatory penalties, and damage to the practice's reputation. The manager must exercise careful judgment to ensure that financial data is handled appropriately without compromising patient confidentiality. Correct approach analysis. The correct approach involves segregating patient-specific financial information from general operational accounting records. This aligns with the core accounting principle of maintaining distinct ledgers for different purposes and directly addresses the regulatory requirements of HIPAA. By creating separate, secure systems for billing and accounts receivable that are distinct from the general ledger, the practice ensures that patient financial data is protected while still allowing for accurate tracking of revenue and expenses. This method upholds the ethical duty of confidentiality and complies with the privacy provisions mandated by HIPAA, demonstrating best professional practice in a healthcare accounting context. Incorrect approaches analysis. One incorrect approach involves directly integrating all patient financial transactions into the general ledger without any segregation. This is a significant regulatory and ethical failure because it bypasses necessary safeguards for protected health information. 5. HIPAA strictly mandates that financial information directly linked to patient care is considered PHI and must be protected. This approach would expose sensitive patient financial data to a broader range of personnel with access to the general ledger, increasing the risk of unauthorized disclosure and violating patient privacy rights. Another incorrect approach is to rely solely on manual, paper-based tracking of all patient financial data, even for basic accounting functions. While this might seem to offer a layer of physical security, it is an inefficient and error-prone method that fails to leverage modern accounting systems. More importantly, it does not inherently provide the robust audit trails and access controls required by HIPAA for electronic PHI, nor does it facilitate efficient financial analysis. The lack of structured digital record-keeping can lead to inaccuracies and makes it difficult to demonstrate compliance with financial reporting standards and privacy regulations. A third incorrect approach is to use a single, unencrypted spreadsheet for all financial data, including patient billing information. This is a critical regulatory and ethical failure. Unencrypted spreadsheets are highly vulnerable to unauthorized access, data breaches, and accidental disclosure. This method directly contravenes HIPAA security rule, which requires appropriate administrative, physical, and technical safeguards to protect the confidentiality, integrity, and availability of electronic PHI. Such a practice would expose the practice to severe penalties for non-compliance. Professional reasoning. Professionals should employ a decision-making framework that prioritizes regulatory compliance and ethical considerations alongside sound accounting principles. This involves 1. Identifying all applicable regulations, e.g., HIPAA, relevant state medical board guidelines, federal financial reporting standards. 2. understanding the specific data types involved, e.g., 5. Financial transactions. 3. Evaluating accounting principles in the context of healthcare data handling. 4. Implementing systems and processes that ensure data segregation, security, and auditability. 5. Regularly reviewing and updating these systems to maintain compliance and best practices. In this scenario, the manager must recognize that patient financial data is intertwined with PHI and requires specific protections beyond standard accounting practices. Question 9. Stakeholder feedback indicates a pattern of potentially inflated billing for certain diagnostic tests, raising concerns about fraud, waste, and abuse. As the certified medical office manager, what is the most appropriate initial course of action to address this feedback while adhering to regulatory frameworks? Option A. Advise the stakeholders that such concerns are common and that the practice operates within standard billing guidelines without conducting a formal review. Option B. Immediately confront the billing staff involved and implement new billing protocols without further investigation, based on the assumption that the feedback is accurate. Option C. Initiate a comprehensive review of billing records, coding practices, and supporting documentation for the identified tests, consulting internal policies and relevant federal and state regulations to determine if any discrepancies or violations have occurred. Option D. Focus on identifying the specific financial losses incurred due to the suspected overbilling and initiate immediate efforts to recoup those funds from payers. The correct answer is C. Initiate a comprehensive review of billing records, coding practices, and supporting documentation for the identified tests, consulting internal policies and relevant federal and state regulations to determine if any discrepancies or violations have occurred. Explanation. Scenario analysis. This scenario presents a common challenge in medical office management, balancing the need for efficient patient care with the imperative to prevent fraud, waste, and abuse. The challenge lies in identifying subtle indicators of potential misconduct without alienating staff or patients, and in implementing corrective actions that are both effective and compliant with regulatory requirements. The medical office manager must exercise sound judgment, relying on established protocols and a thorough understanding of relevant regulations. Correct approach analysis. The correct approach involves a systematic and documented investigation. This begins with gathering all relevant information, including patient records, billing data, and staff interviews, to establish a factual basis for the concern. The manager must then consult the office's established policies and procedures for fraud, waste, and abuse prevention, as well as relevant federal and state regulations, e.g., HIPAA, Stark Law, Anti-Kickback Statute, False Claims Act, as applicable to the CMOM jurisdiction. This approach ensures that any actions taken are based on evidence, are consistent with established guidelines, and comply with legal mandates. It prioritizes due diligence, fairness, and regulatory adherence, which are fundamental to maintaining an ethical and compliant practice. Incorrect approaches analysis. Ignoring the feedback or dismissing it without investigation is a significant regulatory and ethical failure. This inaction could allow ongoing fraud, waste, or abuse to continue, exposing the practice to severe penalties, including fines, exclusion from federal healthcare programs, and reputational damage. It also demonstrates a disregard for stakeholder concerns and a failure to uphold the practice's responsibility to prevent such activities. Implementing immediate disciplinary action without a thorough investigation is also a failure. This approach can lead to unfair treatment of staff, potential legal repercussions for wrongful termination or defamation, and can create a climate of fear and distrust within the office. It bypasses due process and fails to establish concrete evidence of wrongdoing, which is a prerequisite for disciplinary action under most employment laws and ethical guidelines. Focusing solely on recouping potential financial losses without addressing the root cause of the suspected issue is another incorrect approach. While financial recovery is important, it does not prevent future occurrences. A comprehensive approach must include identifying and rectifying the systemic issues that allowed the suspected fraud, waste, or abuse to arise, which is a core requirement of effective compliance programs. Professional reasoning. Professionals in medical office management must adopt a proactive and systematic approach to fraud, waste, and abuse prevention. This involves establishing clear policies, providing regular training, and fostering an environment where concerns can be raised without fear of reprisal. When concerns arise, the decision-making process should follow these steps. 1. Acknowledge and document the feedback. 2. Initiate a thorough, objective, and confidential investigation based on established protocols and regulatory requirements. 3. Consult with legal counsel or compliance experts if necessary. 4. Take appropriate corrective action based on the findings, ensuring it is consistent with policies, regulations, and employment law. 5. Implement measures to prevent recurrence. This structured approach ensures accountability, protects the practice, and upholds ethical standards. Question 10. The evaluation methodology shows that a medical office manager is responsible for overseeing the secure management of patient information and ensuring efficient communication channels. A new patient portal is being implemented, and the office manager must decide on the protocol for patient access and communication regarding appointment reminders and test results. Primary concern is maintaining HIPAA compliance while facilitating timely patient engagement. Option A. Allow patients to opt in to receive appointment reminders and test results via unsecured text messages to their personal mobile phones, with a disclaimer that this method is not fully secure. Option B. Grant all office staff broad access to all patient portal features and information, assuming they are all involved in patient care to some degree. Option C. Implement a secure patient portal with multi-factor authentication for login, encrypted messaging for communication, and a clear policy that staff must only access patient information on a need-to-know basis for treatment, payment, or healthcare operations. Option D. Rely on verbal confirmation of patient identity over the phone for all inquiries about appointment details and test results, without any additional verification steps. The correct answer is C. Implement a secure patient portal with multi-factor authentication for login, encrypted messaging for communication, and a clear policy that staff must only access patient information on a need-to-know basis for treatment, payment, or healthcare operations. Explanation. The evaluation methodology shows that a medical office manager must navigate complex patient data privacy regulations while ensuring efficient office operations. This scenario is professionally challenging because it requires balancing the legal mandate of HIPAA with the practical need for timely patient care and communication. A misstep can lead to significant legal penalties, reputational damage, and erosion of patient trust. The correct approach prioritizes patient privacy and compliance with HIPAA regulations by implementing a secure, multi-factor authentication system for accessing electronic health records, (EHR), and ensuring all staff receive regular, documented training on privacy protocols. This represents best professional practice because it directly addresses the core requirements of HIPAA, specifically the security rule and the privacy rule, which mandates safeguarding protected health information, from unauthorized access, use, or disclosure. Documented training also demonstrates due diligence and a commitment to a culture of compliance. An incorrect approach that involves sharing patient appointment schedules via unsecured email to external vendors fails to protect PHI, violating the HIPAA security rules requirements for technical safeguards. This exposes sensitive patient information to potential breaches and unauthorized access. Another incorrect approach, which relies solely on verbal confirmation of patient identity without any documented verification process, increases the risk of misidentification and unauthorized disclosure of PHI, contravening the HIPAA privacy rules' emphasis on reasonable safeguards to prevent incidental disclosures. Finally, an approach that permits staff to access patient records for non-work-related reasons, even if they are colleagues, constitutes a clear violation of the HIPAA privacy rules' principle of minimum necessary access, as it is not for a legitimate treatment, payment, or healthcare operations purpose. Professional decision-making in such situations requires a systematic approach. First, identify the core regulatory requirements, HIPAA in this case. Second, assess the operational needs of the office. Third, evaluate potential risks associated with each operational decision, particularly concerning PHI. Fourth, select the option that demonstrably meets regulatory obligations while minimizing risk and supporting efficient, ethical patient care. Regular review and updates to policies and procedures based on evolving regulations and best practices are also crucial. Question 11. Regulatory review indicates that a patient's adult sibling, who is not listed as an emergency contact, calls the medical office requesting a copy of the patient's recent lab results to assist with a family health matter. The office manager is aware the patient is currently out of town and unreachable. What is the most appropriate course of action to ensure compliance with the Health Insurance Portability and Accountability Act, HIPAA? Option A. Inform the sibling that the information cannot be released without the patient's explicit written authorization due to HIPAA regulations. Option B. Release the lab results to the sibling, assuming the patient would want their family to have access to this information for health-related reasons. Option C. Provide the lab results to the sibling after confirming their identity and relationship to the patient, explaining that family members often assist with health matters. Option D. Ask the sibling for the patient's date of birth and address to verify their identity, then release the lab results to them as they are family. The correct answer is C. Provide the lab results to the sibling after confirming their identity and relationship to the patient, explaining that family members often assist with health matters. Explanation. This scenario presents a common challenge in medical offices, balancing the need for efficient patient care with the stringent requirements of HIPAA. The office manager must act as a gatekeeper for protected health information. 5. Ensuring that disclosures are authorized and necessary. The core of the challenge lies in understanding the nuances of HIPAA privacy rule, particularly regarding when information can be shared without explicit patient authorization. The correct approach prioritizes patient privacy and adherence to HIPAA by verifying the legitimacy of the request and ensuring it falls within permissible uses and disclosures. This aligns with the fundamental principle of HIPAA, which is to protect the confidentiality, integrity, and availability of PHI. By seeking clarification and confirming authorization, the office manager upholds the trust placed in the practice by its patients and avoids potential legal and financial repercussions. An incorrect approach that immediately provides the requested information without verification fails to acknowledge the sensitive nature of PHI and the legal obligations under HIPAA. This could lead to a breach of privacy, resulting in significant penalties for the practice and damage to its reputation. Another incorrect approach, which involves refusing to provide any information whatsoever, might be overly cautious and could hinder legitimate care coordination or legal requirements, potentially impacting patient well-being or the practice's operational efficiency in a way that is not mandated by HIPAA. A third incorrect approach, which involves guessing or assuming the patient's consent, is a direct violation of HIPAA requirement for explicit authorization for most disclosures. This demonstrates a lack of diligence and a disregard for patient rights. Professionals should approach such situations by first identifying the nature of the request and the requesting party. They should then consult HIPAA regulations and practice policies to determine if the disclosure is permissible. If there is any doubt, seeking clarification from the patient or legal counsel is the most prudent course of action. This systematic process ensures that decisions are informed, compliant, and ethically sound, protecting both the patient and the practice. Question 12. Compliance review shows that the medical practice's recruitment process for a new medical assistant relies heavily on referrals from current staff and informal interviews, where the hiring manager asks a different set of questions to each candidate based on their initial impression. What is the most appropriate course of action to ensure compliance with recruitment regulations? Option A. Continue using staff referrals as the primary source for candidates, but ensure the hiring manager is aware of anti-discrimination laws during informal interviews. Option B. Implement a standardized interview process with job-related questions for all candidates and develop clear, objective criteria for evaluating qualifications, ensuring all hiring decisions are documented and based on these criteria. Option C. Update the job description to include a requirement for candidates to have worked in similar medical practices for at least 3 years, as this is a common industry standard. Option D. Advise the hiring manager to focus on candidates who seem like a good cultural fit for the practice, as this often leads to better long-term employee retention. Correct answer is B. Implement a standardized interview process with job-related questions for all candidates and develop clear, objective criteria for evaluating qualifications, ensuring all hiring decisions are documented and based on these criteria. Explanation. This scenario presents a common implementation challenge in medical office management, balancing the need for efficient recruitment with strict adherence to federal and state employment laws, particularly concerning discrimination and fair hiring practices. The challenge lies in ensuring that the recruitment process, from initial advertisement to final selection, is free from bias and complies with all applicable regulations, such as those enforced by the Equal Employment Opportunity Commission, (EOC), in the United States. The correct approach prioritizes a structured, objective, and legally compliant recruitment process. This involves developing clear job descriptions based on essential functions, using standardized interview questions that probe job-related skills and experience, and ensuring that all hiring decisions are based solely on qualifications and suitability for the role. This method upholds best professional practice by minimizing legal risk, promoting diversity and inclusion, and fostering a fair and equitable workplace. It aligns with the principles of equal employment opportunity, preventing discrimination based on protected characteristics like race, religion, gender, age, or disability. An incorrect approach that relies on informal networks or subjective assessments without a standardized process is professionally unacceptable. This can lead to unintentional discrimination, as personal biases or preferences may influence hiring decisions, even if not explicitly stated. Such practices violate anti-discrimination laws, exposing the practice to significant legal penalties, reputational damage, and a loss of trust from potential employees and the community. Furthermore, failing to document the objective criteria used for selection can make it difficult to defend hiring decisions if challenged, increasing legal vulnerability. Relying on subjective impressions or gut feelings without objective validation is a direct contravention of fair hiring principles and regulatory expectations. Professionals should employ a decision-making framework that begins with a thorough understanding of all relevant federal, state, and local employment laws. This includes familiarizing themselves with EOC guidelines and any specific state-level anti-discrimination statutes. The process should involve creating standardized job descriptions, developing structured interview guides with job-related questions, and training all individuals involved in the hiring process on fair and legal interviewing techniques. Documentation is crucial. All hiring decisions should be based on objective criteria, and the rationale for selection should be clearly recorded. Regular review and updating of recruitment policies and procedures are also essential to ensure ongoing compliance and best practice. Question 13. Benchmark analysis indicates that a significant percentage of claims submitted by a medical practice are being denied due to issues with patient demographic and insurance information accuracy. The office manager is tasked with developing a strategy to address these denials and improve the revenue cycle. Which of the following strategies best aligns with regulatory compliance and best practices for denials management and appeals? Option A. Prioritize appealing only those denials that are within the last 30 days, as older denials are unlikely to be overturned. Option B. Focus solely on appealing denials related to coding errors, as these typically represent the largest reimbursement amounts, and disregard denials for minor demographic inaccuracies. Option C. Resubmit all denied claims immediately without investigating the specific denial reason, assuming the initial submission had a technical glitch. Option D. Implement a robust front-end verification process for patient demographics and insurance eligibility at the time of scheduling and registration, coupled with a systematic review and appeal process for all denials, ensuring timely submission of supporting documentation. The correct answer is D. Implement a robust front-end verification process for patient demographics and insurance eligibility at the time of scheduling and registration, coupled with a systematic review and appeal process for all denials, ensuring timely submission of supporting documentation. Explanation. Scenario analysis. This scenario presents a common challenge in medical office management: a high volume of claim denials due to incomplete or inaccurate patient demographic and insurance information. The professional challenge lies in efficiently and effectively addressing these denials to ensure timely reimbursement while maintaining compliance with payer regulations and patient privacy. The urgency stems from the direct impact on the practice's revenue cycle and financial stability. Careful judgment is required to prioritize appeals, identify root causes, and implement corrective actions to prevent future denials. Correct approach analysis. The correct approach involves a systematic and compliant process for managing denials. This includes thoroughly reviewing the denial reason, gathering all necessary supporting documentation, e.g., medical records, prior authorization details, patient registration forms, and submitting a well-documented appeal within the payer's specified timeframe. This approach aligns with the principles of accurate billing and coding, adherence to payer policies, and diligent revenue cycle management, all critical for a certified medical office manager. It prioritizes patient care continuity by ensuring claims are processed correctly and revenue is secured. Incorrect approaches analysis. One incorrect approach is to dismiss denials with minor errors without appealing, assuming the effort outweighs the reimbursement. This is professionally unacceptable, as it directly impacts the practice's revenue and can indicate a lack of diligence in revenue cycle management, potentially violating payer agreements that require timely appeals. Another incorrect approach is to resubmit the claim without addressing the denial reason, which is a futile effort and does not comply with the appeals process outlined by payers. This demonstrates a failure to understand or follow established denial management protocols. A third incorrect approach is to delay the appeal process beyond the payer's stipulated deadline. This is a significant regulatory and ethical failure, as it forfeits the right to appeal and is a direct violation of payer contract terms, leading to unrecoverable revenue and potential penalties. Professional reasoning. Professionals should approach denial management by first understanding the specific denial reason provided by the payer. This requires a thorough review of payer remittance advice, RAW, or electronic remittance advice (ERA). Next, they must consult the practice's internal policies and procedures for denial management, as well as the specific payer's appeal guidelines. This involves identifying the root cause of the denial, whether it's a coding error, missing authorization, incorrect patient information, or eligibility issues. The decision-making process should then focus on gathering all relevant documentation to support the appeal, ensuring accuracy and completeness. Finally, the appeal must be submitted within the payer's designated timeframe and in the format requested by the payer. This systematic approach ensures compliance, maximizes reimbursement, and contributes to a healthy revenue cycle. Question 14. Implementation of a new electronic health record (EHR) system has led to an unexpected variance in the practice's monthly revenue reconciliation report. The variance is a significant underreporting of patient co-payments collected at the point of service. As the Certified Medical Office Manager, CMOM, what is the most appropriate initial action to take to address this financial reporting issue? Option A. Defer a thorough investigation of the variance until the next quarterly financial review to avoid disrupting daily operations. Option B. Immediately investigate the EHR system's co-payment collection module for data entry errors or integration issues with the billing software, and review audit trails for any system-related anomalies. Option C. Manually adjust the current month's revenue reconciliation report to reflect the expected co-payment amounts based on historical data and address the system issue later. Option D. Inform the billing staff that the discrepancy is likely due to their collection process and instruct them to be more diligent in the future. The correct answer is B. Immediately investigate the EHR system's co-payment collection module for data entry errors or integration issues with the billing software, and review audit trails for any system-related anomalies. Explanation. The scenario presents a common challenge in medical office management, balancing the need for accurate financial reporting with the practical realities of day-to-day operations and the potential for staff oversight. A medical office manager must understand the implications of financial data not just for billing and collections, but also for strategic decision-making, compliance, and the overall financial health of the practice. The challenge lies in ensuring that financial reports are not only generated, but are also interpreted and acted upon appropriately, considering the regulatory environment. The correct approach emphasizes proactive identification and correction of discrepancies, aligning with the CMOM responsibility for maintaining accurate financial records and adhering to relevant regulations. This demonstrates best professional practice by prioritizing integrity, accuracy, and compliance. Specifically, it reflects the ethical obligation to ensure financial transparency and the regulatory requirement to maintain auditable financial records. By investigating the root cause of the variance, the manager ensures that future reporting is more reliable and that any systemic issues are addressed, preventing potential compliance violations or financial misstatements. An incorrect approach that focuses solely on adjusting the current report without investigating the underlying cause fails to address potential systemic issues. This could lead to recurring errors, misinformed business decisions, and a lack of accountability. Ethically, it represents a superficial fix that undermines the integrity of financial reporting. From a regulatory standpoint, it could be viewed as an attempt to obscure or misrepresent financial data, potentially violating principles of accurate record-keeping. Another incorrect approach that involves ignoring the discrepancy due to time constraints is a direct abdication of professional responsibility. This not only compromises the accuracy of financial reporting, but also creates a significant compliance risk. Regulations often mandate timely and accurate financial reporting, and ignoring material variances can lead to penalties or sanctions. It also signals a lack of commitment to financial stewardship, which is a core competency for a medical office manager. A further incorrect approach that involves blaming staff without a thorough investigation is unprofessional and counterproductive. While staff performance is a factor, attributing financial discrepancies solely to individuals without understanding the process or system failures is an oversimplification. This can damage team morale and prevent the identification of genuine process improvements. Ethically, it is unfair to staff and fails to uphold principles of due process. Regulatory compliance requires a systematic approach to financial management, not a blame game mentality. The professional decision-making process for similar situations involves a systematic approach. First, identify the discrepancy. Second, investigate the root cause through data analysis and process review. Third, implement corrective actions to prevent recurrence. And fourth, document the findings and actions taken. This ensures accuracy, compliance, and continuous improvement in financial management practices. Question 15. Compliance review shows that a patient's daughter has arrived at the medical office requesting to discuss her mother's recent diagnosis and treatment plan. The daughter states she is her mother's primary caregiver and that her mother would want her to be fully informed. The office manager needs to determine the appropriate course of action regarding the disclosure of the patient's protected health information. 5. Option A. Provide the daughter with a detailed summary of the patient's medical history and current treatment plan, as she is the primary caregiver and the patient would likely consent. Option B. Inform the daughter that the patient has an upcoming appointment but decline to provide any further details about her condition or treatment due to privacy regulations. Option C. Disclose the patient's diagnosis and treatment plan to the daughter based on her verbal assurance that she is the caregiver and that her mother would want her to know. Option D. Request a signed, written authorization from the patient that specifically permits the disclosure of her diagnosis and treatment plan to her daughter before providing any information. The correct answer is A. Provide the daughter with a detailed summary of the patient's medical history and current treatment plan, as she is the primary caregiver and the patient would likely consent. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in medical office management, balancing the need for efficient communication and information sharing with the stringent requirements of patient privacy. The office manager must navigate the potential for accidental disclosure of protected health information. 5. While ensuring that legitimate requests for information are handled appropriately and legally. The challenge lies in identifying the subtle but significant differences between permissible disclosures and violations of patient confidentiality. Correct approach analysis. The correct approach demonstrates a thorough understanding of the Health Insurance Portability and Accountability Act, HIPAA, privacy rule. It prioritizes obtaining explicit written authorization from the patient before disclosing any PHI to a third party, even a family member who is actively involved in the patient's care. This aligns with the core principle of HIPAA, which mandates patient consent for most disclosures of their health information. The office manager's action of requesting a signed release form ensures that the disclosure is documented, specific in its scope, and legally compliant, thereby protecting both the patient's privacy and the practice from potential penalties. Incorrect approaches analysis. One incorrect approach involves disclosing the patient's information to the daughter based solely on her stated role as the patient's caregiver and her assertion that the patient would want her to have the information. This is a direct violation of HIPAA. While the daughter may indeed be a caregiver, HIPAA requires explicit authorization from the patient or their legal representative for such disclosures, unless specific exceptions apply, e.g., immediate threat to health or safety, which is not indicated here. Relying on assumptions or verbal assurances bypasses the necessary safeguards. Another incorrect approach involves providing the daughter with a summary of the patient's medical history without any form of patient authorization. This constitutes an unauthorized disclosure of PHI. Even if the daughter is a caregiver, the office manager cannot unilaterally decide what information is appropriate to share. The scope of information shared must be clearly defined and authorized by the patient. A third incorrect approach, which might seem helpful, is to inform the daughter that the patient has an upcoming appointment, but to refuse to provide any details about the patient's condition or treatment. While this avoids disclosing specific PHI, it still potentially violates the spirit of HIPAA if the patient has authorized broader communication with their caregiver. More importantly, it fails to address the core issue of obtaining proper authorization for any disclosure, even seemingly minor ones. The office manager should have guided the daughter on the process of obtaining authorization rather than simply refusing to engage. Professional reasoning. When faced with requests for patient information, medical office managers must adopt a systematic decision-making process rooted in regulatory compliance and ethical practice. This process involves 1. Identifying the nature of the request. Is it for general information, specific medical records, or something else? 2. Determining the requester, who is asking for the information: patient, family member, other healthcare provider, legal entity. 3. Assessing the legal basis for disclosure. Does HIPAA or other relevant regulations permit or require this disclosure? 4. Verifying authorization. If authorization is required, has it been obtained in the correct format, e.g., written, signed? Is it specific to the information requested and the recipient? 5. Consulting policies and procedures. Does the practice have established protocols for handling such requests? 6. Seeking guidance if unsure. If there is any ambiguity, consult with the practice's privacy officer, legal counsel, or compliance department. By following these steps, office managers can ensure that patient privacy is protected while facilitating necessary and authorized information exchange. Question 16. The risk matrix shows a high probability of employee disputes arising from inconsistent application of disciplinary procedures and wage adjustments. As the certified medical office manager, which approach best optimizes compliance with labor laws and employment regulations in this situation? Option A. Prioritize immediate cost-saving measures by reviewing employee classifications and benefits, making adjustments where perceived inefficiencies are identified, without extensive legal consultation. Option B. Implement a standardized, documented disciplinary process and a transparent, legally compliant system for wage adjustments, ensuring all actions are based on objective criteria and consistently applied across all staff. Option C. Address employee disputes on a case-by-case basis as they arise, relying on informal discussions and the manager's discretion to resolve issues and make necessary adjustments. Option D. Focus on updating the employee handbook with general guidelines for conduct and compensation, assuming staff will interpret and apply these guidelines consistently. The correct answer is B. Implement a standardized, documented disciplinary process and a transparent, legally compliant system for wage adjustments, ensuring all actions are based on objective criteria and consistently applied across all staff. Explanation. The scenario presents a common challenge in medical office management: balancing operational efficiency with compliance with labor laws. The risk matrix highlights potential issues arising from inconsistent application of employment policies, which can lead to legal disputes, financial penalties, and damage to the practice's reputation. Careful judgment is required to ensure all employment actions are fair, consistent, and legally sound. The correct approach prioritizes a thorough review of all relevant federal and state labor laws, including those pertaining to wage and hour, anti-discrimination, and employee classification. This ensures that any policy changes or disciplinary actions are not only consistent with internal practices, but also fully compliant with legal mandates. This approach represents best professional practice because it proactively mitigates legal risks, promotes a fair and equitable work environment, and upholds the ethical responsibility of the medical office manager to protect both the employees and the organization. Adherence to these regulations, such as the Fair Labor Standards Act, FLSA, for wage and hour issues, and Title VII of the Civil Rights Act for anti-discrimination, is paramount. An incorrect approach that focuses solely on immediate cost savings without considering legal implications could lead to violations of wage and hour laws, such as misclassifying employees as independent contractors to avoid benefits and overtime pay. This is a direct violation of the FLSA. Another incorrect approach that involves making employment decisions based on personal biases or anecdotal evidence, rather than objective performance metrics and established disciplinary procedures, could result in discrimination claims, violating laws like the Americans with Disabilities Act, ADA, or Title Roman 7. Failing to document disciplinary actions properly or inconsistently applying policies creates a significant legal vulnerability and undermines the principle of fairness. The professional decision-making process for similar situations should involve a systematic approach. First, identify the specific labor law or regulation potentially implicated. Second, consult internal policies and procedures to ensure consistency. Third, gather all relevant facts and documentation objectively. Fourth, seek legal counsel if there is any uncertainty about compliance or potential legal ramifications. Finally, implement decisions in a documented, consistent, and fair manner, always prioritizing legal compliance and ethical treatment of employees. Question 17. Compliance review shows that a claim was submitted to a secondary insurance payer for a service that should have been covered by the patient's primary insurance, based on the information on file at the time of service. The front desk staff noted a potential discrepancy in the insurance information provided by the patient on the day of the visit, but the claim was processed using the initially recorded details. What is the most appropriate immediate action for the medical office manager? Option A, immediately bill the patient for the full cost of the service. Option B, submit the claim to the secondary payer as originally processed, assuming they will coordinate benefits. Option C, verify the patient's current insurance information and resubmit the claim to the correct primary payer. Option D, contact the secondary payer to inform them of the error and request the claim be returned. The correct answer is C. Verify the patient's current insurance information and resubmit the claim to the correct primary payer. Explanation: scenario analysis. This scenario is professionally challenging because it involves a discrepancy between the patient's insurance information and the services rendered, directly impacting accurate claims submission. A medical office manager must balance efficient claims processing with adherence to payer policies and regulatory requirements to prevent claim denials, potential fraud allegations, and financial repercussions for the practice and the patient. The manager's judgment is crucial in determining the appropriate course of action to rectify the situation while maintaining compliance. Correct approach analysis. The correct approach involves verifying the patient's current insurance information and resubmitting the claim with the accurate payer details. This aligns with the principles of accurate and truthful claims submission, mandated by payers and regulatory bodies like the Centers for Medicare and Medicaid Services, CMS, under the Health Insurance Portability and Accountability Act, HIPAA. Correctly identifying the responsible payer ensures that the claim is processed according to the patient's benefits and the provider's contract, minimizing errors and potential audits. This practice upholds ethical billing standards and promotes efficient revenue cycle management. Incorrect approaches analysis. Submitting the claim to the incorrect payer without verification risks immediate denial and may be considered a misrepresentation of services, potentially leading to accusations of fraudulent billing practices. This violates the principle of accurate claim submission and can result in financial penalties and reputational damage. Ignoring the discrepancy and proceeding with the claim as is, or submitting it to the original payer despite knowing it's incorrect, is a direct violation of payer agreements and federal regulations. This demonstrates a lack of due diligence and can lead to claim rejections, delayed payments, and potential recoupment of funds if paid erroneously. It also fails to protect the patient from potential out-of-network charges or unexpected bills. Attempting to bill the patient directly for services that should have been covered by insurance, without exhausting all avenues for correct claim submission, is unethical and may violate patient billing regulations. This can lead to patient dissatisfaction and disputes, and it bypasses the established process for insurance adjudication. Professional reasoning. Professionals should employ a systematic approach to claim submission. When a discrepancy is identified, the first step is to pause and investigate. This involves cross-referencing patient demographic and insurance information with reliable sources, such as the patient's insurance card, the payer's online portal, or direct communication with the patient. Once the correct information is confirmed, the claim should be corrected and resubmitted promptly. This methodical process ensures accuracy, compliance, and efficient financial operations. Question 18. Investigation of a medical office's approach to implementing a new electronic health record (EHR) system reveals a focus on rapid deployment and staff training on basic functionalities. The office manager has not initiated a formal process to identify potential vulnerabilities in the EHR system, or to assess the likelihood and impact of unauthorized access to patient data. Which of the following represents the most appropriate risk management strategy for the EHR system in this context? Option A. Implement a data backup strategy without a formal risk analysis of potential security breaches. Option B. Prioritize user training on EHR features over security awareness training to maximize efficiency. Option C. Rely on the EHR vendor's security protocols as sufficient protection for patient data. Option D. Conduct a comprehensive risk assessment to identify potential threats and vulnerabilities to electronic protected health information, EFI, and implement appropriate safeguards. The correct answer is D. Conduct a comprehensive risk assessment to identify potential threats and vulnerabilities to electronic protected health information, EFI, and implement appropriate safeguards. Explanation. This scenario presents a common challenge in medical office management, balancing the efficiency and benefits of electronic health record (EHR) systems with the paramount need for patient data security and privacy. The professional challenge lies in identifying and mitigating potential risks associated with EHR implementation and ongoing use, ensuring compliance with all applicable regulations. Careful judgment is required to prioritize patient safety and confidentiality while optimizing operational workflows. The correct approach involves a systematic and proactive risk assessment process. This methodology aligns directly with the principles of patient data protection mandated by regulations such as HIPAA, Health Insurance Portability and Accountability Act, in the United States, which is the assumed jurisdiction for the CMOM exam. A thorough risk assessment identifies vulnerabilities, analyzes potential threats, and evaluates the likelihood and impact of security breaches. Based on this analysis, appropriate safeguards can be implemented to protect protected health information, (FI). This proactive stance is considered best professional practice because it demonstrates a commitment to regulatory compliance and ethical patient care. It ensures that the EHR system is not only functional but also secure, minimizing the risk of data breaches, identity theft, and other privacy violations. An incorrect approach would be to assume that simply implementing an EHR system automatically guarantees security. This overlooks the inherent vulnerabilities of digital systems and the evolving nature of cyber threats. Failing to conduct a risk assessment is a direct violation of HIPAA security rule, which requires covered entities to conduct a risk analysis to identify potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic PHI. Another incorrect approach is to focus solely on the technical aspects of the EHR without considering the human element. User error, insider threats, and inadequate training can all lead to security breaches, regardless of the sophistication of the EHR software. This oversight neglects the importance of comprehensive security policies and procedures, which are also mandated by HIPAA. Finally, an approach that prioritizes cost savings over security measures is ethically and legally unacceptable. While budget constraints are a reality, patient data security must always be the primary concern, and any cost-cutting measures that compromise security are a failure of professional responsibility and regulatory compliance. Professional decision-making in similar situations should follow a structured process. 1. Identify the objective, e.g., implementing or optimizing an EHR. 2. Understand the relevant regulatory landscape, e.g., HIPAA. 3. Conduct a comprehensive risk assessment to identify potential threats and vulnerabilities. 4. Develop and implement appropriate security policies, procedures, and technical safeguards. 5. Provide ongoing training to staff on security best practices and EHR usage. 6. Regularly review and update the risk assessment and security measures to adapt to new threats and system changes. Question 19. What factors determine the most effective appointment scheduling techniques for a medical office aiming to optimize patient access, provider efficiency, and overall clinic workflow? Option A. The primary goal of maximizing provider billable hours through a strictly first-come, first-served walk-in system. Option B. The preference of the front desk staff for a simple, single-method scheduling approach, irrespective of patient needs or clinic demands. Option C. The historical average appointment duration for all services, regardless of patient urgency or provider availability. Option D. The practice's patient demographics, provider specialties, appointment types, and the need for flexibility to accommodate urgent cases and minimize wait times. The correct answer is D. The practice's patient demographics, provider specialties, appointment types, and the need for flexibility to accommodate urgent cases and minimize wait times. Explanation. This scenario presents a common challenge in medical office management, balancing patient access with efficient resource utilization while adhering to regulatory and ethical standards. The professional challenge lies in creating an appointment scheduling system that is both patient-centered and operationally sound, avoiding backlogs, no-shows, and potential breaches of patient privacy or regulatory compliance. Careful judgment is required to select scheduling techniques that optimize provider time, minimize patient wait times, and ensure smooth clinic flow. The correct approach represents best professional practice because it prioritizes patient needs and provider availability through a flexible, multifaceted system. This approach acknowledges that different appointment types and patient circumstances require varied scheduling methods, such as wave scheduling for urgent cases, modified wave for managing flow, and open access for immediate needs. This adaptability ensures that the practice can respond effectively to patient demand, reduce wait times, and maximize the utilization of clinical resources, all while maintaining a high standard of care. Furthermore, it aligns with the ethical obligation to provide timely and accessible health care. An incorrect approach that relies solely on a fixed appointment schedule without considering patient urgency or provider capacity can lead to excessive wait times, patient dissatisfaction, and potentially missed revenue opportunities due to underutilized provider time. This rigidity fails to address the dynamic nature of healthcare needs and can create bottlenecks. Another incorrect approach that overbooks without adequate buffer time or provider availability risks provider burnout and compromises the quality of care by rushing through appointments. This can also lead to patient frustration and a perception of poor service. A third incorrect approach that neglects to implement confirmation or reminder systems increases the likelihood of no-shows, which wastes valuable appointment slots and provider time, impacting clinic efficiency and revenue. This failure to proactively manage appointments can also be seen as a lack of professional diligence in resource management. Professionals should employ a decision-making framework that begins with understanding the practice's specific patient population, provider specialties, and operational capacity. Should then evaluate various scheduling models, considering their strengths and weaknesses in relation to these factors. Implementing a pilot program for new techniques, gathering feedback from both staff and patients, and continuously monitoring key performance indicators such as wait times, no-show rates, and patient satisfaction are crucial steps. This iterative process allows for informed adjustments to optimize the scheduling system, ensuring it remains effective, compliant, and patient-focused. Question 20. When evaluating the current medical coding system's effectiveness and identifying areas for improvement in a busy cardiology practice, which approach best ensures ongoing compliance with federal regulations and optimizes claim submission accuracy? Option A. Conduct a thorough review and update of the practice's coding policies and procedures, followed by targeted training for all coding staff on the latest ICD-10, CPT, and HCPCS guidelines and any relevant payer-specific requirements. Option B. Rely on the individual expertise of the most experienced coders to identify and correct any coding discrepancies as they arise. Option C. Implement a performance metric that rewards coders for the highest volume of claims processed per day, regardless of accuracy rates. Option D. Invest in the latest medical coding software and expect it to automatically resolve most coding issues with minimal staff intervention. The correct answer is A. Conduct a thorough review and update of the practice's coding policies and procedures, followed by targeted training for all coding staff on the latest ICD-10, CPT, and HCPCS guidelines and any relevant payer-specific requirements. Explanation. This scenario presents a common implementation challenge in medical offices, ensuring accurate and compliant medical coding. The challenge lies in the need for a systematic approach that not only addresses immediate coding needs, but also establishes a sustainable process for ongoing accuracy and compliance with federal regulations, specifically the Centers for Medicare and Medicaid Services, CMS, guidelines, and the Health Insurance Portability and Accountability Act, HIPAA. The medical office manager must balance efficiency with the critical requirement of precise coding for reimbursement and regulatory adherence. The correct approach involves a comprehensive review and update of the existing coding policies and procedures, coupled with targeted staff training. This strategy directly addresses the root cause of potential coding errors by ensuring that the team is working with current guidelines and possesses the necessary skills. It aligns with best professional practice by proactively mitigating risks of claim denials, audits, and potential penalties associated with noncompliance. This approach fosters a culture of accuracy and continuous improvement, which is essential for long-term operational integrity and financial health. An incorrect approach would be to solely rely on individual coder expertise without a formal review process. This fails to establish a standardized, auditable process and leaves the practice vulnerable if a coder's knowledge becomes outdated or if there are inconsistencies in interpretation. This approach risks regulatory noncompliance as it doesn't ensure adherence to the latest CMS coding updates or HIPAA privacy rules related to patient data. Another incorrect approach is to implement a new coding software without addressing underlying process deficiencies or providing adequate training. While technology can be a valuable tool, it cannot compensate for a lack of fundamental coding knowledge or poorly defined workflows. This can lead to misinterpretation of software outputs and continued coding errors, potentially increasing claim rejections and audit flags. It also overlooks the crucial element of staff competency, which is a key component of HIPAA security and privacy rules. A third incorrect approach is to focus solely on increasing coding speed without a corresponding emphasis on accuracy. This is a direct violation of professional ethics and regulatory requirements. The primary goal of medical coding is to accurately reflect the services provided for appropriate reimbursement and statistical purposes. Prioritizing speed over accuracy can lead to upcoding or downcoding, both of which carry significant financial and legal repercussions, including fraud and abuse allegations. This approach undermines the integrity of patient records and billing processes. The professional reasoning process for this situation should involve a risk assessment of current coding practices, identification of specific areas for improvement, and the development of a phased implementation plan that prioritizes accuracy, compliance, and staff competency. This includes regular audits, ongoing education, and clear communication channels for addressing coding challenges.